Thank you for being here, everyone. The Senate Special Committee on Aging will come to order today. We welcome those who are here for our fifth hearing of the 118th Congress. And this hearing will focus on including older adults and people with disabilities in emergency management and response. In the 2 years since the committee held a hearing on this topic, we've witnessed devastating emergencies and disasters across the country. While all Americans are affected by disasters and emergencies, older adults and people with disabilities are disproportionately affected. The most devastating of recent disasters, of course, is the COVID-19 pandemic. More than 75% of COVID-19 deaths, some 850,000 Americans, were adults over the age of 65. So 75% of the deaths were in the age category over the age of 65. And while those with, and at the same time I should say, those with developmental disabilities were nearly 3 times more likely to die from COVID-19 than those without a disability. While the pandemic has had a disastrous effect on older adults and people with disabilities, natural and man-made disasters also have a disproportionate effect on them as well. Last year, Hurricane Ian killed at least 150 people in Florida and North Carolina, with nearly 2/3 of those who lost their lives were over the age of 65. As you'll hear from one of our witnesses, the train derailment in East Palestine, Ohio, which caused about 5,000 people to flee their homes in both Ohio and Pennsylvania, had a profound impact on people with disabilities. In this committee's recent joint report with the Senate Finance Committee, this is a copy I'm holding up, entitled "Left in the Dark," we recommended that older adults and people with disabilities be included as an essential part of the entire emergency planning process. In the report, we stressed the importance of making the resources to prepare and respond to emergencies available to all who need them, including, of course, older adults and people with disabilities. As we will hear from our witnesses today, one of the most essential resources during an emergency is, of course, information. Information. People with disabilities and older adults need accurate, accessible, and comprehensive information to plan for and to respond to emergency situations. That is why I, along with 11 of my colleagues, including Senators Gillibrand, Blumenthal, Warren, and Fetterman from this committee, have introduced the Real Emergency Access for Aging and Disabilities Inclusion for Disasters Act. For short, thank goodness we have an acronym, the Ready for Disasters Act, REAADI, Ready for Disasters Act. This bill would ensure that people with disabilities and older adults are included in both disaster preparation and that their needs are considered during both response and recovery efforts. It would also ensure that the civil rights of older adults and people with disabilities are not violated during disaster emergencies. So whether it's a pandemic, a natural disaster, or a human-made emergency, older adults and people with disabilities need to be considered in both planning and response. So I look forward to hearing recommendations from our witnesses about how we can ensure disaster planning, response, and recovery are truly, truly inclusive. And I'll now turn to Ranking Member Braun for his opening statement.
Thank you, Mr. Chairman. Disaster can strike anyone, anywhere. Just this past April, we had over 20 tornadoes hit the ground in Indiana, causing damage and devastation in communities across the state. Witnessed the disaster firsthand in Sullivan, Indiana, not too far from where I live, when I met families that lost their homes and offered federal assistance to the mayor in that case. Older adults and people with disabilities were particularly vulnerable in the aftermath. We must do more to plan ahead before disaster strikes. When I ran a business for 37 years, we budgeted for things outside the ordinary. We didn't go on a kind of a disorganized spending spree. We had it in place. That's why you have insurance. That's why you have rainy day funds. This isn't something special because most other places do it. And the scale, even to the size of the ones that attract federal attention, you could still be doing the same thing. Most Americans are very practical. They try to save and prepare for that rainy day, for that unforeseen event. My home state of Indiana has had over $2.5 billion in reserves. We are always prepared. And if you don't do that, you have to dig your hole even deeper, because right now, this federal government is borrowing 30 cents on every dollar we spend. And it's going the wrong way, because it was just 20 cents when I got here 4.5 years ago. It was 18 trillion in debt, now 31 trillion. That is a terrible business plan for the future, including how you confront disasters. Talked about COVID earlier. You're throwing money at the problem does not necessarily stop the course of a tornado or the spread of viruses. This is an expensive lesson that we've learned, and Chairman Casey mentioned how it ravaged senior citizens. Always senior citizens seem to be in that place of most peril when there is a disaster that comes along. We spent $4 trillion on COVID alone. We borrowed every penny of it. We lost more than 1.1 million lives to it. Instead of prioritizing the highest risk groups, which we should have, because we knew the science of the disease very quickly, we ended up just following the political science. And what did it do? More money borrowed, more money spent, and it really didn't do a great job on protecting those that needed it most. The record inflation that we're dealing with now does not bode well for putting emergency funds together, which we need to. At the heart of this is big government. From 2019 to 2023, the federal spending grew by 40%. We cannot adopt the model of panicked crisis governance as a standard response for emergencies. After 3 years, it took 2 measures by Congress to end the COVID-19 national emergency. Why should Congress have to fight to end an emergency? We should have to fight to keep it in place. The American people are simply looking for things that make more sense, like they see in their own lives, in their state governments. They see a place here run by bureaucrats that generate generally decisions that are counterproductive. Last week, I joined Senators Lee, Blumenthal, Crapo, Risch, and Murphy. That's a broad bipartisan effort to introduce the Article 1 Act. This bill would automatically terminate national emergencies if Congress does not renew them. The federal government should do more to plan ahead for emergencies and change the trajectory of emergencies, especially to protect older Americans and those with disabilities. I look forward to learning from you, advice on your end in terms of what to do. But generally, it's going to have to be housed within a system that doesn't take us deeper in debt, that actually would do a big rainy day emergency fund here and quit borrowing money from future generations for whatever we do.
Thank you, Senator Braun. Now we'll introduce our witnesses. Our first witness is Dr. D.D. Bennett-Gale, who is an associate professor at the University of Albany's College of Emergency Preparedness, Homeland Security, and Cybersecurity at the State University of New York at Albany. Her research focuses on emergency management, socially vulnerable populations during disasters, and communications during emergencies. Thank you, Dr. Bennett-Gale, for being with us today and for sharing your expertise and experience with the committee. Our second witness is Annie Lloyd from Darlington, Pennsylvania, in Beaver County. She lives roughly 5 miles from East Palestine, Ohio. Ms. Lloyd and her family were directly affected when a train carrying dangerous chemicals derailed in East Palestine just a few months ago. Thank you, Ms. Lloyd, for sharing your experience and your story with us today. And now I'll turn to Ranking Member Braun to introduce our third witness.
Mr. Jonathan Bidlack is a director of the governance program at the R Street Institute. He is focused on fiscal, budget, and legislative branch policy. Jonathan received his bachelor's degree in economics with minors in finance and political economy from Princeton. In May, Mr. Bidlack published The Known Unknowns, Planning for the Next Emergencies. The report calls for planning ahead for emergencies rather than relying on off-budget emergency spending. Thank you for agreeing to testify today, Jonathan. Appreciate it.
Thanks very much, Senator Braun. Our fourth witness is Dr. Masheed Abir. Dr. Abir is a senior physician policy researcher at RAND Corporation and a practicing emergency physician. During the pandemic, she led COVID-19 related projects, including identifying strategies to increase critical care capacity in intensive care units and strategies to boost COVID-19 vaccine acceptance. Thank you for sharing your expertise with us, Dr. Abir. And we'll start with our first witness, Dr. Bennett Gale, for your opening statement.
Good morning. Thank you, Chairman Casey and Ranking Member Senator Braun, for having me here today. It is an honor to testify before the committee. This is such an important issue. Most marginalized members of our society are often disproportionately impacted during disasters, and negatively so. These populations include older adults and people with disabilities, racial and ethnic minorities, low-income populations, LGBTQ communities, among others. And in fact, there is some research that estimates the marginalized members of our society or socially vulnerable populations account for nearly 50% of our population or more. Some of the concerns for older adults and people with disabilities are the lack of inclusion across the life cycles of a disaster, lack of understanding about the social conditions that contribute to their vulnerability, a focus on agent-specific rather than an all-hazards approach, trying to change our culture of preparedness, and a dearth of sponsored research to address many of these concerns. We are aging, healthier, longer, and more independently living. Our older adult population is also more racial and ethnically diverse, overwhelmingly women, and is rapidly increasing. For example, my grandmother lived to be just over 96 before she passed away just this past October. Though her mobility slowed as she aged, her health was far superior than most in my family, without common physical ailments outside of arthritis. Plus, her memory was completely intact. The vulnerability of older adults is not merely the result of their pre-disaster health or direct injury sustained. Social factors that contribute to their increased vulnerability. These factors include being left out of emergency planning, preparedness, response, recovery, and mitigation efforts. This also includes the increased isolation that many older adults and people with disabilities face in the aftermath of a disaster. Our culture of disaster preparedness is more reactive than it is proactive. Legislation often follows an extreme event and is agent-specific. However, we see the very similar disproportionate impacts across all hazards concerning our more vulnerable populations. Federally sponsored research has underscored the importance of investments in infrastructure-related studies and, more recently, health-related medical studies to tackle disaster preparedness. Research should also proactively fund social, human behavioral factors, and workforce-related studies pertaining to disaster vulnerability. The Real Emergency Access for Aging and Disability Inclusions for Disasters Act has the potential to focus our attention on fixing known challenges and ensuring the inclusion of older adults and people with disabilities. With potential investments in research centers, this act can fund necessary empirical studies related to the impacts of our marginalized populations, and I have some recommendations. We need to address how our citizenry think about and understand disasters. For one, disasters are not natural. The term natural disasters can be misleading, encouraging individuals to dismiss the notion that there is something they could actually do to reduce their risk. To empower individuals, we need to encourage people to be aware of their local hazards and to prepare for them appropriately. The whole community approach to disaster requires a dedicated focus on building capacity. However, we often focus on the deficiencies of our marginalized populations instead of understanding their strengths and capabilities. This leads us to talking at people instead of listening to people. Our focus on deficiencies is likely related to our preconceived notions about aging and ability. We must shed these biases. With older adults living longer, healthier, and independent lives, it is important to consider their unique needs, include them in developing preparedness plans, listening to their experiences, and learning from them. We need to also consider the heterogeneity of these populations, as older adults do not all reside in nursing homes and may have informal caregivers who are members of their family or spouses of a similar age, or they very may well live alone. This is similar to every older adult in my family currently. People with disabilities are often also discussed as a homogeneous group of people. However, they are of all ages and have differing abilities. Furthermore, these populations also vary in their racial, ethnic, and cultural background. As we plan for and study populations, we must factor in that we are not all just a member of one group. We must make investments before a disaster occurrence. We should proactively introduce legislation to increase preparedness, such as the Ready for Disasters Act. Additionally, these investments should follow an all-hazards approach rather than an agent-specific one. The issues and lessons learned across most of our major disasters are similar. After-action reports tell a particular story where communications, coordination, community engagement, and reaching vulnerable populations are significant issues. This means that sponsored research should also focus on remedying these challenges and increasing knowledge transfer with the workforce. We are only as resilient as our most vulnerable populations. Again, thank you for inviting me to speak before the committee, and I welcome your questions.
Thank you, Dr. Bennett-Gale. Ms. Lloyd, you may begin your testimony.
Good morning. My name is Annie Lloyd, and I would like to tell you about my family's experience with the East Palestine train derailment. We moved to Darlington, Pennsylvania after my husband served in the Navy. My toddler son, Teddy, was showing signs of developmental delays, so we felt a quiet rural life would be beneficial. He would later be diagnosed as being on the autism spectrum, with additional symptoms of anxiety and ADHD. Now 9 years old, he is incredibly active, imaginative, and very funny. He can land a punchline like no one I've ever met. He is also dependent on special education services that include access to his school's autism resource room, a special education teacher, a paraprofessional, therapies, and special transportation. Immediately after news broke that a train derailed in East Palestine, 5 miles from our house, it became very clear to me that finding reliable information to keep our family out of harm's way would be difficult. You see, I have a journalism degree, and I have worked at multiple media outlets over the last 15 years. Living in a rural area places us in a news media barren desert. Residents of my community often end up relying on social media neighborhood watch groups to try to figure out what's going on. And as you can guess, the posts and comments can be riddled with rumors and false information. The pressure building up in the derailed train cars was becoming increasingly concerning. At the time, I had concluded that the major concern was shrapnel from the anticipated explosion. So sending my kids to school that day, to a school that was further away from the derailment than our home, seemed to be the sensible thing to do. Not long after, we got the call that our kids were being evacuated, and officials blocked off all westbound roads at my street, something I didn't realize until I saw the barricades. My son arrived home with a note from his special education teacher that she told him he was being evacuated because a train was stuck. She often responds to Teddy's anxiety and meltdowns, and her precise, subtle explanation met Teddy's needs and was greatly appreciated by all of us. He was totally stoked to be off school early, so he immediately took to running in the yard, as he often does after school, to help him regulate his emotions, anxiety, and need for movement. But today, I said, would not be a day he could get his running in, because we have to stay safe from the stuck train. It wasn't long after that the black cloud erupted from the controlled explosion, igniting concern of chemical contamination. Those concerns continue to this day, as no testing has been available to us, and no one has told us about the conditions of the air, well water, and soil around our property. Senators, we desperately need more reliable information. We needed clear communication from authorities with intimate knowledge of the train derailment, of what the danger was, and who needed to take active steps in protecting themselves. Evacuating disabled kids from their schools and hoping that they will navigate their way out of harm's way in an emergency is simply not enough. No disaster is ever truly expected, but everyone should be prepared for by our local and county emergency response authorities. And first in those preparations should be the needs of our most vulnerable. At moments like these, I'm reminded as my child's caretaker that I will not live forever, and there will be a day where he will be navigating emergencies on his own. It's a perpetual feeling in the pit of my stomach, having struggled myself, a non-disabled person, with figuring out what to do to stay safe during the explosion, to know that someday my son will be doing this without me. Senators, I am asking you, as a mother of a son with a disability and a friend of many disabled people, all of whom make unique, remarkable contributions to our communities, to put forth a comprehensive accommodation plan for our disabled citizens for times of emergencies and disasters. There is nothing more fundamental to a dignified life than the capability of self-preservation. What is freedom if not equal ability to survive? Thank you for your time.
Ms. Lloyd, thank you very much for your testimony. We're grateful you bring your own personal story. Next, Mr. Bidlack, for your opening statement. Thank you.
Thank you. Chairman Casey, Ranking Member Braun, and members of the committee, very much appreciate today's hearing and the opportunity to testify before you. My name again is Jonathan Bidlack, and as mentioned, my specialty is in budget policy and improving government efficiency to better serve constituents. The pandemic and its response imposed significant hardship on Americans, particularly the older and disabled. Being better prepared for the next crisis, whether public health or otherwise, can help ensure that no Americans are left behind. Smart planning preserves resources and ensures that any federal response benefits those who need it, rather than furthering waste and abuse. Emergency events affect vulnerable segments of the population the most, and so do the unintended consequences of poor planning and irresponsible budgeting. In everyday life, we understand that a car accident is an emergency. It requires a rapid response and temporarily special powers, like letting ambulances run red lights or speed on their way to the hospital. But increasingly, in the context of national emergencies, the executive continues to use special powers long after the crisis. Just as we don't let injured drivers run red lights on their way to physical therapy, so too must we limit emergency powers to the time of actual crisis. In recent years, the number of federally declared emergencies has increased dramatically, and so has federal spending in response. Officially designated emergency spending has totaled more than $3 trillion since 2000, but the true impact on the U.S. economy and the federal budget is much greater. The federal response to the COVID-19 pandemic cost more than $5 trillion. Spending overseas expanded dramatically during the 2 decades after 9/11, and disaster supplementals in our response to the financial crisis in 2008 also contributed to our increasingly tenuous federal balance sheet. Put simply, emergencies have added up, especially since this spending is typically enacted without any offsets. There are also substantial private costs, and I'm thinking of closed businesses, and underemployment, and more recently, higher inflation and interest rates. Many economists at the Federal Reserve and others have written about the relationship between expansive pandemic-related spending and persistent inflation. I have with me an article from CBS News, the headline of which reads, "Inflation is slamming U.S. seniors. It's a scary time," one disabled widow said. Unchecked spending poses real costs to Americans who are lower income or on a fixed income. With each additional unexpected expenditure, vulnerable populations are threatened further by trust fund insolvencies, crowding out other budgetary priorities, and potential benefit cuts if nothing is done. As a recent Social Security trustees report warned, the odds are rising of a 23% benefit cut as soon as 2033 without a change in the status quo. Fortunately, there are reforms that Congress should consider. These include limiting the length of emergencies and restoring the proper role of Congress. The executive branch must often act quickly, but the legislature should not allow emergencies to extend unchecked for months and years. The recent bipartisan effort to end emergency declarations after 30 days absent congressional action is a good idea. And when an emergency has been declared, Congress should target funds and demand transparency. For example, instead of trying to claw back pandemic funding after the fact, Congress could have required states to publish how they spent funds as a condition of aid in the first place. Most states were able to respond to the pandemic thanks to the strength of their budget stabilization funds. We should explore such options at the federal level to alleviate fiscal strain in times of crisis. As we now re-enter a world of federal spending limits, such mechanisms could ensure that adequate funding for emergencies is immediately available, rather than relying on off-budget spending and gimmicks. Well-designed fiscal rules in other countries should also be considered. Sweden's entitlement program guardrails have become a worldwide model, as just one example, instituted to safeguard their safety net programs. And finally, we should help people continue to save. The federal government can incentivize individuals to prepare for emergencies and make existing savings vehicles more flexible. Efforts enacted in last year's omnibus, including the chairman's ABLE 2.0, should be expanded to further increase savings opportunities for Americans with disabilities. Thank you again for holding today's hearing and for your consideration of these important issues. And I look forward to any questions that you may have.
Thank you, Mr. Bidlock, and we'll turn next to Dr. Abir. I don't know if your microphone is on.
Apologies. Thank you, Chairman Casey, Ranking Member Braun, and distinguished members of the committee for the opportunity to testify today. In addition to being a health services researcher at RAND, I am a practicing emergency physician and worked on the front line during the COVID-19 pandemic. The views I share today reflect my clinical experience in the emergency department for nearly 2 decades and an expertise as a health services and public health researcher. On a typical day in the emergency department, many older adults and individuals with chronic diseases present for care. Many of these patients have multiple comorbidities and long lists of medications, and some are dependent on life-sustaining medical devices. The process of getting to the emergency department itself can be a massive feat for these individuals, often necessitating transfer via ambulance or dependence on family or transportation services. During emergencies, these populations' challenges in seeking health care are compounded by the uncertainties presented by these events. Disruptions in access to food, shelter, transportation, electricity, health services, and medications can put older adults and people with disabilities in an even more vulnerable position. Any one of these disruptions can lead to acute exacerbations of chronic illnesses and the need for care in the emergency department and inpatient settings. The routine challenges faced by health systems and social services in the U.S. are also amplified during these events. For example, during the COVID-19 pandemic, healthcare workforce shortages strained the emergency department and hospital capacity. and emergency department boarding of hospitalized patients, where admitted patients may stay in the emergency department for days waiting for an inpatient bed, worsened. This strained health system capacity during emergencies can adversely affect outcomes among older adults and people with disabilities. Because of this two-pronged exacerbation of vulnerabilities among these populations and in the health and social services systems, mitigating the needs of older adults and people with disabilities requires special consideration distinct from the rest of the population. Given that preparedness, response, and recovery is likely most challenging in the context of these groups because of the intensity of their healthcare and social services needs, framing related policies and practices based on them are likely to improve the processes for all Americans. In order to effectively plan for the response and recovery needs of older adults and people with disabilities, a data-driven approach and leveraging technology is imperative. For example, the size of these populations and the nature and degree of their healthcare and social services needs need to be routinely measured in every community across the United States to inform mitigation plans and anticipating the needed resources. Paired with a national all-hazard surveillance system, such data could inform planning for the needs of these groups based on the nature of the event. Further, because many older adults may live alone and may not have a reliable source of communication with response entities, advanced knowledge of the locations of these individuals and plans for outreach during emergencies will be critical. Beyond leveraging data and technology, Congress could take steps to advance the health and safety of older adults and people with disabilities in emergency contexts, such as requiring Medicaid payments to be made out of state for older adults and people with disabilities during public health emergencies and disasters. Extending Medicare 20% increase for inpatient COVID-19 care to all Medicare-eligible adults and people with disabilities during future incidents. Requiring the development of resources and capabilities within public health departments to address the needs of older adults and people with disabilities. Another opportunity is the currently in progress reauthorization of the Pandemic and All Hazards Preparedness Act, otherwise known as PAPA. PAPA reauthorization offers an opportunity to modernize preparedness, response, and recovery capabilities at all levels of government through investing in more effective and efficient strategies. Part of redefining our preparedness, response, and recovery framework is planning for the worst-case scenario that affects the most vulnerable in our communities, including older adults and people with disabilities. I thank you again for this opportunity and look forward to your questions.
Thank you, Dr. Abir. Appreciate your testimony and your experience. I wanted to start a round of questions. I'll start with Ms. Lloyd. You're a journalist, and you have to get facts right, and you know the importance of accurate information, especially in the context of an emergency. I'm sure you're also sensitive to how, and you made reference to this in your testimony, about how disinformation or rumors or other misleading information can put families at risk and put a whole community at risk. In the aftermath of the train derailment in Ohio, news organizations got facts wrong. You shared in your own testimony that you and your neighbors could only find information through local Facebook groups and that these became rumor mills, to use your words, that cause unnecessary panic. Why is it important for families like yours that include people with disabilities and older adults to have access to accurate, trustworthy information about both emergencies and disasters as they're occurring and, of course, in their aftermath?
Yeah, I think not everybody has discernment. I think a lot of people who are new to technology, especially in our rural area, think because it's printed on a website that it's official and it's true. And in this case, it obviously was not necessarily the case. I know of people who live 20 miles out that were getting hotel rooms that probably the people who lived within the 1 mile radius of the explosion desperately needed. there seemed to be no information czar or no information manager who was managing the information coming out from our like town supervisors, our local state representatives. It just seemed to be a free-for-all.
Mm-hmm. Nothing that was centralized, huh?
Not that I could find.
Mm-hmm. Well, that's one of the challenges in this area of policy to try to improve that. We'll talk more about that. I wanted to turn to Dr. Bennett Gale. In your testimony, you talked about the importance of a whole community approach to emergency preparedness. The Ready for Disasters Act will create a commission that will have on the commission people with disabilities, older adults, and experts to provide guidance on inclusion of those Americans on such a commission, so that they're prepared and we're prepared during disasters. These particular citizens of ours have specific needs before, during, and after disasters that are often ignored. Dr. Bennett Gale, what specific challenges do older adults and people with disabilities face after a disaster strikes, and why is it so important that they have a seat at the table throughout all phases of emergency preparedness?
Thank you for the question. I believe it's not just in response and recovery that they have their challenges. What happens during preparedness, and I think we should invest more money in preparedness, is that they're often left out of the exercises and simulations when we're thinking about and planning for people with disabilities. There needs to be some proper inclusion. So sometimes you may see someone without a disability being a mock actor trying to figure out what their needs might be, and that doesn't necessarily cause anyone to figure out what their actual needs are. They should be included in planning. In response during warnings and emergency messaging, there needs to be consideration for American Sign Language and prominent languages in the area. Reaching out to populations only gets us halfway there. Did they understand the message, and can they actually comply with that message is something that we really haven't looked at as much. We're starting to think about that, but we're doing a lot of research on making sure that we have clear, consistent, and accurate messaging going out and trying to reach the populations, but often just having numbers on how many people that receive the message doesn't actually get us to know if they are able to understand the message and if they're able to take the necessary precautions. In evacuation, we can figure out how to maintain their social connections and social networks. That's extremely important because if they are unable to, then they fare way worse than if they actually are able to keep up with their social connections. And then in search and rescue, we have problems with trying to figure out where people are located. These groups are not necessarily geographically located all together. So how do you figure out where they are? Registries have not worked in the past. Registries only pick up about 5% of our population in a particular area, and at best. And then when we do have registries, you have a number of people who don't want to be on them, especially those who are people with disabilities and some older adults, and we have to take that into consideration. With recovery, there's early evidence, especially even recently from Hurricane Harvey, of the paperwork being very detailed and being very difficult to navigate, and that also hinders people from filling out the paperwork or getting information so that they can recover. And it may not consider unique household dynamics. Some of the paperwork does not consider the fact that families living in a particular area have passed down their houses from person to person, and then you don't have a deed. Or it doesn't consider the fact that you may have grandparents, and a number of them are, taking care of young children, and how do they actually navigate that system. And then mitigation, it's costly. At the individual level, a lot of our older adults are on fixed incomes, and it's not easily explained. That takes some time to do. We have evidence of it working where people have been able to mitigate and do it at the household level, but that has taken way more than 30 days. It's taken quite like a year or so. And a good example of that is in Greensburg, Kansas. After tornadoes, they did get a chance to get individuals to start thinking about green living or changing their household structures so that it would be better off. But that took a lot of community engagement and explaining to individuals what was happening so that they can buy into the system.
Doctor, thanks very much. I'll turn to Ranking Member Braun.
Thank you, Mr. Chairman. Mr. Bidlack, earlier we talked about on all emergency spending, we basically borrow the money. Done nowhere else through insurance, through any other government entity. They have to deal with emergency funds and rainy day funds. And I think you said that over the last 2 decades, it's north of maybe $10 trillion that have been added to the federal debt. Can you explain why a rainy day fund, an emergency fund, would actually be a better way of doing it?
Yeah, thank you for the question. I think if I start, if you just consider a quick back of the envelope calculation, the cost of war project at Brown University estimates that we've spent around $8 trillion in total on the war on terror, and that was spending that was not expected pre-2001. If you consider the money that we spent on the pandemic, that's another $5 trillion. That was obviously not really expected prior to early 2020. And then if you consider the $3 trillion in sort of officially designated emergency spending, that's alone is $15, $16 trillion out of an increase in the national debt of $26 trillion over that time. You're talking well north of 50%. So I think that the impact, you're correct to point out, of emergency spending, whether officially designated or otherwise, has been very significant. In the context of emergency funds, I think to some degree it speaks for itself. If we look at how states were able to respond in the pandemic, they had, their emergency funds were pretty much flush with cash in the early stages, and that put them in a very strong position. I think that there's been a lot of sort of misinformation, maybe, that it was a requirement that they get funds from the federal government to replenish their emergency funds, but their emergency funds were in very strong shape early on, and the same was true even going back to the 2008 financial crisis. And so the value here is that you have actual funds put aside for these types of expenditures, which, look, is the kind of thing that we all do in our own private lives and that we expect even businesses to do to plan for unforeseen events. And the other underappreciated part, I think, of emergency funds is just the speed. As we learned in the context of the pandemic, the ability to respond quickly to an emergency or disaster situation is incredibly important. And so it's not just that you have money, it's that you also are able to respond in a much quicker fashion. And so I think it's something that we should definitely consider at the federal level, especially when we consider that at many points in time, the federal government has served as sort of a de facto backstop. And so it's very important that we have our federal finances in as strong of a position as possible, and an emergency fund could very well be an important component of that.
And I think sooner or later, when you have any understanding of fiscal policy, macroeconomics, you are going to pay the piper with inflation and other things that happen due to that approach. So when it comes to how would you, what policy proposals out there, is there anything else other than creating a rainy day fund, which is probably unlikely here? I don't think we'll do that until you hit the ditch fairly hard. Any other policy proposals that would make it a more sane approach, rather than, we know the need is there, but it's the approach in this place that defaults to the, to me, shameful process of just putting more and more debt onto every body that's in a future generation, kids and grandkids.
Yeah, I like to be a little bit more optimistic, perhaps, and hope that we might be able to go and implement an emergency fund. Look, I think there are a lot of lessons from the States and from other countries. I mean, I referenced in my written testimony the Swedish case where Sweden was actually found themselves in a very similar situation in the 1990s. They had a generous social safety net. They don't sit on a large amount of oil reserves like their neighbor to the west, and they had to really think about how can we ensure the sort of programs that many people are reliant on, and they implemented statutorily, budget caps that put some level of restraint on their expenditures. And you see very effectively that countries like Sweden or Switzerland, perhaps being the other example that's often used, those countries have tended to respond far more effectively to crises, and done so in a way that didn't result in just blowing up their budgets.
So they have a fairly, they got somewhat larger central government probably budget, but they don't borrow money to spend what they want to spend, and they're taking the responsibility of putting savings into emergency funding, which again is what all other places have to do. This is the only place that seems to try to violate that rule routinely.
Yeah, I mean, in this country, we just went through the debt limit fiasco, crisis, whatever you want to call it, and I think there's a lot of acknowledgement from people on both sides of the aisle that the way that we deal with our sort of expenditures in this country is not ideal. There are virtually no other countries that have this exact same process. I think Denmark is the only other one. And instead what they do is they cap their expenditures as a function of expected revenue, which is itself a function of what they've taken in recently and what they expect in the short term. And that's a much smarter way of doing it, and it gives you a lot more flexibility to respond to unforeseen events. I mean, in the Swiss case, they don't have an emergency fund explicitly, but they're able to engage in emergency spending, and then it sort of that impacts what they're able to spend in the coming 5 or 6 years. And so again, these types of lessons I think are very important, and big picture have wide-ranging implications for both the finances of the country and how we deal with emergencies.
Thank you.
Thank you, Ranking Member Braun. We'll turn to our next senator in a moment. I just want to mention, as many of you know, follow the work of this committee and the schedule on Thursdays. We're going to have senators in and out, some appearing and having to leave and come back, some appearing and being able to ask questions. So we've had Senator Kelly here and Senator Blumenthal, and we'll now turn for questions to Senator Ricketts.
Great. Thank you very much, Mr. Chairman. And thank you to all of our witnesses for being here this morning. I was the governor of Nebraska from 2015 till just this year, and we dealt with a number of disasters, and including the COVID pandemic, but also tornadoes, wildfires, flooding, you name it. And appreciate all your comments, specifically with regard to older Americans and Americans with disabilities, because they are disproportionately impacted for all the reasons that you've just outlined, whether it's the burden of paperwork or just people not thinking through how to be able to handle folks who have additional needs. And frankly, one of the things I also want to hit upon, well, two things I want to hit upon. One is just making sure that we are doing the planning ahead of time and how important that can be, but also not having a one-size-fit-all answer. According to the Surgeon General advisory, one of the things I also want to hit upon in that second part is with regard to loneliness, but I'll talk about planning first. One of the things that we did in Nebraska is we got a CDC grant that allowed us to establish in 2015 the Infection Control Assessment and Promotion Program. And that was a training program in conjunction with the University of Nebraska Medical Center to be able to actually go to our skilled nursing facilities and assisted living facilities to train them in infection control. And this is one of the things that allowed us to be able to perform relatively better with regard to those congregate living situations that we knew for older adults in particular were so dangerous with the COVID pandemic. Now, how you actually get states to make those kind of decisions ahead of time, I don't have a good answer for. I would love to say I was so smart and told people to do that. That was not the case. It was somebody in my Department of Health and Human Services who made the decision, working with the University of Nebraska Medical Center, to establish that program well in advance of the COVID pandemic to allow us to train our healthcare professionals in those facilities so that they had a leg up when the pandemic hit. And then, of course, we really ramped those programs up. So advanced planning can make a difference. We demonstrated here in Nebraska versus some other states, which, for example, made some of the horrible decisions about sending people who had COVID back into those types of facilities that led to additional problems. Another thing is just how we have to avoid having one-size-fit-all answers coming from the federal government, because that's one of the things that really leads to bad outcomes and poor health outcomes for our senior citizens and so forth. This is where I was going to read this one. According to the Surgeon General Advisory, loneliness and isolation have detrimental effects on public health. The National Academies of Sciences, Engineering, and Medicine reports loneliness and isolation in older adults are strongly associated with greater incidences of morbidity, cognitive decline, depression, anxiety, and a decreased quality of life, and increased risk of early death of all causes. And I know that specifically I've had a number of providers in Nebraska talk to me about this. One in particular is Papillion Manor, a skilled care nursing facility that has expressed strong dissatisfaction with CMS's COVID-19 regulations and its effects on parents. Residents report a loss of quality of life as a result of the isolation, which kept residents from events with other residents and other families. And Mr. Bidlack, it kind of gets to your point about having emergencies too long. Well after we didn't need to have the restrictions in Nebraska on, say, communal dining, CMS still had those regulations in place, which really contributed to this loneliness. And of course, Mr. Bidlack, you also mentioned all the $5 trillion in spending, which has helped contribute to inflation, which also hurts our older Americans. But what I'd like to do is just hit upon Dr. Abir. What sort of things did you see, or what sort of experience did you have with regard to kind of a one-size-fit-all answer coming from regulations that may give us an opportunity to look for some flexibility down the road in the future so we can have more of a flexible response to be able to help, whether it's the amount of paperwork for older Americans or Americans with disabilities or other sorts of rules that we might be able to take a look at to be able to get better outcomes?
Thank you so much for this question. So I think that one of the most important things is to understand the specific needs and vulnerabilities of these populations. And yes, plan in advance. And preparedness is one of the major paradigms of, again, preparedness, response, and recovery. The problem is that historically, we've treated, whether it is older adults or people with disabilities, almost similar to everyone else. Whereas, given all the vulnerabilities, the needs are going to be different. The intensity of both social services and health services is going to be quite different. Advanced planning is the key. However, that is also extremely expensive. But it is an investment that is worthwhile. And comparisons with Denmark or Sweden or Switzerland, which are socialist countries that invest tremendously in their health system and social system infrastructures, have healthier populations as a result. And it's not the United States. So I think that we need to think differently because we have a significantly aging population. We have a population that in many instances does not have appropriate access or enough access to social services and healthcare. So I think that we need to think very hard and look back at the COVID-19 pandemic, which is, not just the pandemic of 100 years, but is the worst-case scenario. So who would have planned for a 3-year public health emergency that touched every corner of our nation and cost us, who knows? So for decades to come, we're going to be measuring the impact on lives, on health in general, on loss of workforce, on loss of income, on loss of education, and so many other aspects of society. So we need to take a nice long look at this pandemic and the way that we didn't prepare for it and how we responded to it and how we're going to recover from it. And step back and say, how can we do better, particularly for the most vulnerable populations? Because if you do it right for those populations, you're going to get it right for everyone else as well.
Thank you, Dr. Abir. I would point out, again, in Nebraska, we did take some steps ahead of time in preparing, like our ICAP program, to do it. Again, wasn't mandated, but that's just how we chose to do it with our CDC grant. I'm sorry, Dr. Gale. I was looking at you when I said Dr. Gale or Dr. Abir, but I wanted to ask you the same question, if I may, Mr. Chairman. Could I have a little bit extra time to give Dr. Gale a chance?
Sure.
Again, in your experience, were there things that we could do to provide more flexibility to help us address populations that are older with disabilities?
Sure. I think we can't forget about the social context. I think my fellow panelists here also mentioned it, but when we consider what happened in COVID, right? In the beginning, it wasn't pharmaceutical that we went in terms of response. It wasn't infrastructural. It was a social mandate, right? It was to self-isolate, physical distance, or increase our use of technology to kind of continue our tasks. But that caused some problems, and I don't think we really understood what that was going to cause. And the reason why is because we don't actually fund a lot of the studies to study that. If we're going to increase spending around planning and preparedness, we actually need to know what we're planning and preparing for, and we actually need to know the individuals who are going to be impacted, and we need to invest in the research to do so. That research can't be focused solely on pharmaceutical outcomes because that wasn't our first step, that wasn't our first response. The other thing is I have lived in your state, and I lived in your state during the time that you were governor. And having visited Nebraska Medical Center, a lot of the things they had in place for infectious disease were because they also were dealing with, I think they dealt with the Ebola outbreak at one point, and they already had a lot of stuff in place to deal with infectious disease where other states may not have. So that could be one of the things that made you guys a little bit, better in terms of preparing for this, and that is you had some space in having to deal with it before. So that's also very unique. And when we're thinking about vulnerability, we have to be cautious when we're trying to compare against different societies, not just because the societies are different, but because vulnerability is different across different societies. What makes us more vulnerable in one than another can also be because of social context. And so our vulnerability as an older adult here could be very different in another country. And we have to take that into consideration as well.
Yeah, Dr. Gale, thank you very much. You're exactly right with regard to UNMC. They are a leader in infectious disease control. We do have one of only 3 federally funded contained isolation places, and the only actually quarantine space that was federally funded. And we did handle the Ebola patients that were coming out of West Africa. So we did have the expertise on hand to be able to do things like the ICAP program. And I agree 100% that was kind of my point is, it is not going to be a one-size-fits-all answer. What may work in New York may not work in Nebraska and vice versa. So we do have to be flexible about it. So thank you very much to all our witnesses again. And Mr. Bidlack, I was just going to say one last thing. When we started our emergency response in Nebraska, we did use our rainy day fund to be able to start funding it before the federal government actually got their program in place and started passing it. So anyway, thank you, Mr. Chairman, for being so patient with me as I take up all the time in your committee.
Senator Ricketts, sometimes there's a reward for being at every hearing, I think, so that's, you get extra time. I wanted to turn back to a question for Annie Lloyd. And in your testimony, among so much detail about those hours after the derailment and what you were experienced as a mom and as someone who was not the recipient of a lot of information like so many in the community, you made reference to Teddy's school and the accommodations and help he gets at school. You made reference to his school's autism resource room, a special education teacher, a paraprofessional for his time in general education classes, speech therapy, occupational therapy, and special transportation. All of which are important to note. And then you also talked about his teacher, and I'm just reading directly from your testimony. You said his special education teacher often responds to his anxiety with, quote, brilliance and expertise, and her precise, subtle explanation met Teddy's needs and was greatly appreciated by all of us. And I sometimes think as much as we're often frustrated when there isn't planning, and there isn't planning that includes people with disabilities or older adults, there are some real heroes out there that step up and not only do their job, but go beyond their job. And I thought it was important that you shared that insight into his teacher. what we've got to do here, among other things, is to learn from good behavior and good practices, best practices. Her response is something that we should replicate or imitate and use as a foundation for good policy. I introduced another piece of legislation that's relevant here, the so-called PREP, P-R-E-P, Prep for All Students Act. That would ensure that schools have the tools they need to develop inclusive emergency preparedness protocols. Annie, when there's an emergency or disaster, what kind of information and resources do you think schools need? There's so many places that need good information, but just in the context of schools, and maybe ever more so in the context of schools that have a number of children that have a disability of one kind or another, what information and resources do you think schools need to ensure that children like Teddy are safe?
One thing I can't help thinking about of that day, once a week I go and I work in downtown Pittsburgh, an hour away. I can't help but think if I happened to be in the office that day, an hour away, when all that was happening. I do think, especially in the needs in terms of students with disabilities, there needs to be a way for the school to be able to communicate with each and every individual parent to make sure that when they are evacuating kids in an emergency, that not only will someone be home, but someone capable, a capable caretaker will be home to continue the process of caring for that disabled person. Mm-hmm. That's what stood out to me the most. And I would also add to that is, to this day, I actually have no idea why they were evacuated from school. I think a follow-up would have, it still is, would be appreciated. I have a feeling there's some, there might be some legal, things that, reasons why they sent the kids home. But at one point, my son rides the small bus, and the disabled kids, right before this controlled explosion, were driving toward the explosion to get these kids home. And it did not seem right to me.
Mm-hmm. Well, as you said, I'm looking at page 2 of your testimony, that word navigate jumped out at me, where you said, when evacuating a child with a disability from school, and absent good policy, we're just hoping that they will, quote, navigate their way out of harm's way, unquote. And hoping for that is not the right approach. We've got to do a lot better than that. Senator Scott from Florida is here, and turn to him for his questions.
Thank you, Chairman. First, thank you all for being here. So I've come from the state that has hurricanes, as you probably know. So we unfortunately have lost we had a hurricane last year, and we lost 150 people, and many of them elderly. So I've been traveling the state. I've been in 7 cities in the last 3 weeks trying to get people ready for, prepare for hurricane season, which started June 1. As we know, many elderly don't feel comfortable evacuating, whether it's because they like to be where they are, whether it's because they have pets, whether they're not comfortable they'll have the right food or right medicine, all these issues. So for each of you, do you have any recommendations to make sure that our elderly citizens actually listen to evacuation orders and evacuate early enough?
I think that leveraging networks in the communities, for example, faith-based community, health services, EMS, law enforcement, and ensuring that these networks are aware of these older adults' locations and their needs in advance will be really important. And to communicate, and whoever is the trusted messenger in those communities, to communicate in advance to those communities and populations the importance of being ready to leave with their medications. Let's say they have medical equipment or devices that they're dependent on. So that would make a big difference. But I think it's really important to leverage the right stakeholders and use the right messengers to get through it.
Anybody else?
I would agree. I think additionally, beyond just the trust, it's also thinking about the other social connections that they've made. So it could be an official person, but it could be an informal person. It may be someone from their local house of worship, but it could also be, their next door neighbor. And it's kind of hard to say. That's not we know this in general, but we haven't done extensive research to think about all the different ways to make someone evacuate. We've done research on how to get messages to people. We've done research on who's left behind. We've thought about, all of these different things. But we do need to find out more information, and I think it's going to be unique to each individual. And I think that's where everything kind of gets lost. We look at things in large data sets and we kind of think about people all as the same, but when we get down and nitty-gritty, you'll figure out, oh, well, if we had some information about this, or if we can answer specific questions. I did last year a national hurricane conference have a panelist who was from Florida, and they were emergency management personnel. And during COVID, they said some of the things that helped was as a local emergency management group, going out and talking to the older adults and people with disabilities, and then they found information for them. They can answer their specific questions, and they made the relationships ahead of time because they were from fire department, and it was, very nice, and they were able to make those connections. You don't often hear, that pivot to, okay, I'm just going to go door to door now and try to figure out what's going on. And sometimes it takes a little personal touch. The robocalls don't necessarily work for older adults, so we have to think about other ways. And I think there may be some other examples out there, but they're going to be localized. And so we definitely need to learn more about what emergency management personnel are doing so that we can learn from what they're doing well.
Yes, sir.
I'll just add one quick additional point, which is that I think that we do also need to take sort of a long-term approach to this as well. I mean, we have plenty of Americans who are living in areas that are particularly vulnerable, and we know that we have huge problems with the National Flood Insurance Program, for example, and a number of my colleagues have done work on that topic. So I think that we do also need to kind of think about some of the long-term implications and sometimes some of the perverse incentives that have been created by poor federal policy through the years.
Have you found, like what we do in Florida, we have shelters for people with disabilities, for pets, and we have all these different things. Have you found around the country that most of the states have shelters for specific purposes?
Yes, people, and in general, there's a shelter that shows up, right? The concerns about the shelter situation is that now we're seeing more disasters frequently occurring. Shelters don't stay up long enough. A minimum time is about 2 weeks, and then they're closing, and that's problematic for individuals who actually need that space. The other thing about sheltering is that everyone doesn't show up to the shelter. So you may have a shelter, but it's only for a specific percentage of your population. I don't have that information offhand, but I know it's not nearing 50%, right, of those that are left behind. So when we're thinking about sheltering, we have to think that there are also individuals staying in place at their house instead of going to the shelter. And it could be for a number of different reasons. Maybe there's not enough information about the disability accommodations at the shelter, so they feel like it'll be more comfortable or helpful if they stay at home. It could be other things similar to that. During Katrina, I know you mentioned pets, but we learned a big thing. Oh, people won't leave without their pets. And then we started thinking about putting pets in shelters so that individuals will leave. But there are other things that we haven't learned, and we shouldn't be learning them after a disaster. We should be proactively doing it and learning beforehand so that we can make the right choices and decisions and spend our money wisely prior to a disaster.
Thank you. Take a chair.
Thank you, Senator Scott, and we'll turn next to Ranking Member Braun.
Dr. Abir, you earlier were asked by Senator Ricketts about that kind of one-size-fits-all. You know, as we navigated through COVID, we could see that shutting schools down didn't make sense when we found out that it had very little impact on young people. Shutting businesses down, we spent a fortune. The transmission wasn't occurring there. Hospitals had to stop routine stuff, I think, which had a latent negative impact we still probably can't measure. But the one thing we did know, it ravaged the community 65 years and older, predisposed. I think we focused on so many other areas, and we didn't relent there. What could we have done better once the science was clear that this disease was aimed at a very small group that got disproportionately impacted, and we didn't seem to do a very good job in preventing that?
Yeah, thank you for this really important question. So a couple of things before I answer your question directly. So in hindsight is 2020. I think that this pandemic, the virus, was unknown to us, and we will be learning about the acute and long-term impact of COVID-19 on the human body for decades to come. So at the time when those public health interventions were implemented, we were operating on the best available evidence. But you're absolutely right. When we learned that, for example, kids were not a major vector for transmission, then we should have pivoted from those policies and moved in a different direction, reopened schools. But again, this is hindsight. And I think the lesson for future pandemics, and there will be future pandemics, is to have a data-driven approach so that you are measuring the outcomes and understanding in real time. And that real-time understanding and science is informing policy. And the willingness to say that this virus is unknown to us, we are learning as we are going. And I think that is really a big point, and tell the public that this is what we know now. Based on what we know now, this is what we think we should do, and it may change because this is a novel virus. But I think that we need to start and now, and not waiting another decade until the next big one hits, and say, how can we have systems in place that track data and outcomes in the key population in real time? And once we do that, really identify the highest risk communities and invest the majority of mitigation and resources to those communities.
I think it's great advice, and I think that data was coming in while we were contending with it, and we just were stubborn in not focusing on where we knew the problem was the worst with the elderly. And yes, we now know, and I think set the framework up in the future to do a better job with it. We'll probably contend with it again. Thank you.
Thanks very much. I might have some more questions, but I'll turn to Senator Vance.
Thank you, Mr. Chair. I appreciate you holding this this hearing, and thanks as well to the ranking member. I want to focus. Obviously, there are many different kinds of disasters that affect folks, and the one that I'm most focused on is not a natural disaster, but a man-made disaster. And I know, Ms. Lloyd, you suffered from some pretty significant consequences from the East Palestine train derailment. I will rehash for those of us who have forgotten that on February 3rd, 2023, an eastbound freight train derailed in East Palestine, Ohio, a town of around 5,000 people. Now, 11 tanker cars in the resulting pileup contained hazardous materials, some of which were released into the air, soil, and water of East Palestine in what was called a controlled burn, but it didn't feel like a controlled burn to a lot of people on the ground. People were and still are afraid to let their kids play outside. They're afraid to drink the water. They're afraid of what's happened to their air, and they're afraid of what's happened to their long-term health. Ms. Lloyd, I'm so sorry this happened. I'm so sorry it's something that affected your life. And I maybe thought, just given that a lot of us in D.C., I'm an exception. I know the chairman is an exception as well, but a lot of us in D.C. don't know anybody personally affected by it. Maybe you could walk us through what it was like when that happened, because am I correct that you were living pretty close and still live pretty close to where the train crash happened? Is that right, Ms. Lloyd?
I live 5 miles out.
5 miles out. Could you just maybe walk me through what happened? You know, did you see it? Did you hear it? What were the effects, and how did it affect your family?
Yeah, we definitely did see it. My heart, I am constantly thinking about the people of East Palestine. I don't know if they'll ever, I worry that they'll never feel resolved and at home there anymore. So 5 miles out in the way of Pennsylvania, what we dealt with was our children being evacuated from school. My kids attend the school district in Pennsylvania that was evacuated. I will also say that we have a 6-acre property that sits at a higher altitude than the train derailment site. So when there was the controlled explosion, which looked like a mushroom cloud to me, we got clear view of it, and it was mind-blowing. It was very strange.
Yes, ma'am. And how many kids are at your kids' school? How many children do you know? Approximate number?
I'm going to guess about 400, but I can't say for sure.
That's a lot of scared kids, and that's a lot of scared parents. And I think it's just important to realize that behind these statistics and behind the news stories, there are real people who are affected by this. Ms. Lloyd, would you be surprised to learn there were more than 1,000 train derailments last year alone in this country?
I'm not surprised, no.
Well, you're smarter than I am, because I was shocked when I saw that number. And if you think about East Palestine, that's effectively 1,000 potential East Palestines happening every single year in our country. Of course, most of them aren't that bad, thank God. But when you crash a train, you don't always control where it crashes. Just a couple of months after East Palestine, there was a train derailment about 4 or 5 miles outside of Cleveland that could have been incredibly catastrophic if it had crashed a little bit closer to the city of Cleveland. Thank God that it didn't. But we can't just rely on luck, and we can't just rely on good circumstances to prevent these things from happening. I'm mindful, of course, that while our children are affected by these things in unique ways because their little brains are still developing, they're still trying to understand what they see. A lot of our elderly folks are the ones who can't get out quickly, who can't move quickly, who maybe don't have any alternative when their homes become unlivable. And so I'd encourage members of this body and members of this committee, I know both of you are both working on this with me, and I appreciate it, that we could pass the Railway Safety Act out of this body and out of the House later this summer that would make these accidents much less common and expose you and your family, hopefully, to a railway system that's a lot safer and doesn't allow this thing to happen again. So I'm sorry, Ms. Lloyd, but I'm glad that you're here. I appreciate all of you for being here, and I appreciate your testimony.
Thank you, Senator Vance. I just have maybe one or two more. Dr. Abir, we know that older adults and people with disabilities suffered the most from the COVID-19 pandemic. That's so plain from the numbers. As I said before, just older adults ages 65 and over were 75% of the deaths. The vast majority of deaths and serious illnesses from COVID-19 occurred among those two groups of Americans, both seniors and people with disabilities. We also know that in the context of a particular setting, congregate settings were often the place where people with disabilities and older adults contracted the virus. We know as well that home care is an alternative to congregate care, and older adults and people with disabilities who received support at home often had better outcomes during the pandemic than those in congregate settings. Unfortunately, we have a crisis in home care services in our country. Would you consider the development of a more substantial home care workforce and a network part of both the preparation that's needed here as well as the mitigation for circumstances we're facing a pandemic?
Absolutely. So I think that would be important for preparedness, response, and recovery. And the best thing about this idea is that it's relevant for routine care and routine circumstances, as well as in the setting of emergencies. So if a person is able to get discharged from the hospital sooner because they have a home to go to and there's home care available and scheduled and planned so that the person can go home, a nurse can visit, give them their medications, check in on them, make sure they're eating, or whatever else it may be, that means that that person is spending fewer days in the hospital, occurring lower costs for a hospitalization, likely not picking up a hospital-acquired infection or other complication in the hospital. So I think it's a win-win for everyone. And the current system of let's wait for everyone to get sick enough to go to the emergency department and get hospitalized is not sustainable. And the population, again, is aging. So we need to get creative about our solutions, and the home care and hospital-at-home solution is really something that I think should be at the forefront of strategies that we consider.
Well, thank you. And I think that's among the many. We've learned so many lessons from the pandemic. That's certainly one of them. Maybe just one more question for you, Dr. Abir. You've been doing this work for a long time, and you've done it both from the point of view of a researcher as well as a physician. You've carefully studied the response to public health emergencies all the way from COVID-19 to Puerto Rico after the devastating hurricanes. We're told that since Katrina, the federal government has made a concerted effort to include the needs of people with disabilities and older adults in this emergency planning and recovery processes. Can you share with us some of the improvements you've seen? We're obviously focused on shortcomings and areas where we need to improve, but any improvements or progress you've seen over the past decade when it comes to meeting the needs of those two groups of Americans?
So yes, I think that there has been some progress, although it is a byproduct of thinking about and planning for other populations, not necessarily older adults or people with disabilities. I'll give you an example. So one thing that was, for the longest time, not part of preparedness plans and response plans was planning for people with chronic kidney disease. So people who require hemodialysis, which, as I'm sure you know, is critical for a person. So if they miss enough days of hemodialysis, it is fatal. So planning for hemodialysis for individuals and where they're going to get it if they're displaced or unable to go to their center because they just can't get to the place because of a tornado or hurricane, there are plans developed around that, and a vast majority of folks on dialysis are older adults. So that planning has been critical. Another example is that many emergency departments, I shouldn't say many, some emergency departments in the United States are now certified to specifically take care of older adults. And that just signals to you that how important and different it is, that there are certain needs, even during routine care, that we need to really consider differently and develop kind of practices around this particular population. So yes, I think we've made some advancement, and there's other examples, but I think that we really have kind of not explicitly focused on these populations, and we have not done it in a data-driven way. And I think that the best opportunity now is the hindsight of looking at the pandemic, because it did affect these populations the most, and we now, unfortunately, have plenty of data to look back at.
Well, thanks very much. And I know that we have to conclude, so I want to move to my closing statement before I turn to Ranking Member Braun. But I do want to start by thanking our witnesses for bringing, in each case, a combination of expertise, experience, your personal experience, and your own perspective to these issues, because we have a couple of opportunities. The pandemic, all hazards reauthorization is one of those moments where we can focus on making sure that people with disabilities and older adults are part of the planning and response. But we have to look for other pathways as well. And as we heard today, emergency preparation can only be truly inclusive when all stakeholders are invited to the table and are committed to meeting the needs of all groups of Americans. We heard from Annie Lloyd about the importance of accessible and accurate information, how frightening it can be to not have up-to-the-date, accessible information, especially in her case, worrying about her son and her family. This is why it's so important that emergency planning explicitly protects the health, the safety, and the independence of older adults and people with disabilities. The legislation that I've introduced, the Ready for Disasters Act, will ensure the voices of these individuals are included throughout every phase of emergency preparation. I'll continue to work with my Senate colleagues on the committee and in the Senate to make sure that the Ready for Disasters Act is included in the reauthorization of the Pandemic All Hazards Preparation Act. Together we can protect the health, safety, and independence of older adults and people with disabilities and help communities prepare and respond to disasters and emergencies in a truly inclusive manner. Turn next to Ranking Member Braun.
Thank you, Mr. Chairman. Today we heard from experts, practitioners, and those who lived experiences about the importance of preparing for emergencies. Prudent budgeting and planning are integral for both emergency preparedness and response to be successful. In planning, we should factor in the needs of older Americans and people with disabilities and set aside resources accordingly for current and future generations. We cannot continue to push our debt onto future generations. We've spent, as I said earlier, upwards of $10 trillion on emergencies in just the last 2 decades. So we know they're inevitable. We need to plan accordingly for them. Interest payments on our debt are going to be the single most expensive thing we do in the federal government compared to any discretionary spending, domestic and defense. That's a sad prospect. We need to enact Article 1, which would terminate disaster issues without having to do it in a special way. They can't linger on forever. Ensuring that emergencies terminate without the intervention of Congress, I think, is important. Finally, the COVID pandemic, well in submission, we have a golden opportunity. We discussed it to implement lessons learned and better prepare for the next inevitable occurrence to some magnitude. We can do it better next time around. It just takes some backbone and some foresight. Protecting older adults and people with disabilities in emergencies, it's a nonpartisan issue, and planning ahead to do so should be nonpartisan as well. Eager to work with my friends across the aisle to put these solutions into reality. Appreciate all of you coming here today, and thanks, Mr. Chairman, for the hearing. I think it was a good one.
Ranking Member Braun, thank you very much for your time in working on this issue and working to plan this hearing. I want to once again thank all of our witnesses for their testimony and for being with us today and for contributing both time and expertise. If any senators have additional questions for witnesses or statements to be added, the hearing record will be kept open for 7 days until next Thursday, June 22nd. Thank you all for participating today. This concludes our hearing.